Zimbabwe still stands at 34 confirmed cases for the COVID-19 pandemic. And now for the daily update, I'm joined by the Human Secretary and the Minister of Health and Childcare, Dr. AGNES MAHOMVA. Dr. MAHOMVA, can you give us today's daily update as of the 7th of May?
Thank you very much. Yesterday we did issue it, and the exciting news is that our 34 cases remain at 34, and we've had that 34 for just over a week now. And we sincerely hope it continues like that, not having a lot of confirmed cases. What we're saying, and as you saw our update, is that we are continuing to intensify our testing out there in health facilities, our healthcare workers, and so on and so on. And hence the numbers of those who are confirmed is actually going up. In other words, the number of those who have PCR testing. Remember, there's the issue of doing rapids for screening and so on. That was really a hot debate the past few days. But we want to emphasize to the public out there that our focus remains on surveillance, finding those suspected cases, making sure they are tested, PCR, and of course ensuring that they are isolated, ensuring that we actually follow up their contacts and so on. That is our focus. We want to detect the cases so that we manage them appropriately. So it's a comprehensive package. You can screen at the port of entry by temperature, by so on, and yes, there you can also rapids and so on. The rapids will have their place, but the most important thing is for us to detect cases so that we're able to manage them, so that we're able to know the status of our epidemic in Zimbabwe.
All right, from the reports from the past week, it seems like you're only concentrating on Harare and Bulawayo and you're neglecting other areas.
I'm glad you point that out because it does look like that, but not at all. But first of all, let me say, indeed, we have more numbers here in Harare and in Bulawayo. Those are like our hot spots, and we want the public to know that. However, we also have numbers coming from elsewhere. The reason why sometimes our numbers look to be just in those two areas is because that's where we started with our PCR testing. That's where most of it happens. And so when we get the numbers the numbers when they issue them, the results to us, sometimes we don't have the time to really disaggregate, and we do point that out so that you clearly see where else those numbers are coming from. But yes, Harare and Bulawayo continue to be our hotspots.
All right, and today we're also joined by the President of the Zimbabwe College of Public Health Physicians, Dr. Nikamahachi. Dr. Nikamahachi, maybe you can just start by briefly telling us what is that your association does?
So the Zimbabwe College of Public Health Physicians is a professional association made up of public health specialists, epidemiologists, health economists, many of whom are working within the Ministry of Health, who actually sit and support the ministry in coming up with policies, strategies, and some of our members are actually at district, provincial level. And then we also have members that are working in the NGOs, supporting the government of Zimbabwe, mainly providing technical assistance. So we are actually very much a part of the COVID-19 response in Zimbabwe.
Okay, and so far, what's your overall assessment of what's been done at both political and technical level in as far as the COVID-19 pandemic is concerned?
I want to acknowledge that there's been a lot of progress. The government was fairly swift, particularly His Excellency declaring COVID-19 pandemic as a national emergency. And that is critical, I think, at political level to be able to facilitate resource mobilization and rapid implementation. That was also followed up by setting up of the high-level task force, which is chaired by the Vice President. Again, very critical in showing the political commitment to tackling the COVID-19 pandemic. And then at ministry level, the minister, the honorable minister and the permanent secretary and the various departments within the ministry, working with the cooperating partners like WHO, many other NGOs and technical experts like ourselves, came up with the COVID-19 National Response Plan, which is divided into several pillars in terms of how we intend to address, again, the COVID-19 pandemic. So that's a lot of progress. And then beyond the response plan, there are various pillars that are actually working to operationalize this plan. So for example, there's risk communication, making sure the messages are out there in terms of social distancing, wearing face masks. All of this is critical, and then infection prevention and control, and a lot of training is going on, a lot of messaging is going out. And further to that, the president recently issued another statutory instrument that's looking at the return to work strategy, acknowledging that this pandemic has an impact on the economy, and we need to balance between responding and keeping our economy moving forward. So this is now the critical discussion that we have now to say, so how do we really reopen our industry, including agriculture? And one of the critical issues is to make sure that we focus on what the evidence, what WHO is recommending, what the European Center for Disease Control, what CDC are recommending, who are the pillars that we normally rely on technical guidance. And so what we are saying now is let's focus on a risk-based approach at the workplace, ensuring that employers put in place a system to screen their employees, including assessing the symptoms, checking temperature daily. Whatever employee is identified to be symptomatic, maybe to have a fever, or reports to have had contact with a confirmed case, is immediately isolated. Samples are collected in contact or in collaboration with Ministry of Health rapid response teams, and contact tracing is immediately implemented. This is a more cost-effective measure, acknowledging that the rapid diagnostic testing is a screening tool that is only effective for surveillance purposes, so it's not diagnostic. So we really strongly recommend that symptom-based approach that is backed up by confirmatory PCR testing, and then following our treatment and management protocol that we have as a country.
Okay. And then, Doc, why is it that Zimbabwe is mum? We've heard of other countries talking about clinical trials, about cures, herbs and stuff. Why is it like in Zimbabwe, we just mum?
That's a good question. I think the government of Zimbabwe and the many stakeholders, in many cases, we follow WHO guidelines. We follow what the Center for Disease Control are recommending in terms of how to manage some of these conditions. We are a fairly resource constrained setting, but I know that as a college and other technical experts, we are looking at what is the research agenda that is applicable in our context with the resources that we have. What is it that we can be able to do? So that is work in progress.
Coming to you, Dr. MAHOMVA, in the beginning, we were talking about contact tracing, but now it seems like you've just gone quiet. Are we still following up the contacts?
Absolutely, but let me just add on to what Dr. Mahaji said about research. As a ministry, we are very glad to tell you that we've got a research team that is composed of the Medical Research Council of Zimbabwe. We've got our own National Institute of Health Research led by Professor Midzi, who have actually put in place some subcommittees that are looking in specific areas. There are 7 in total, and they have a lot of areas that they're looking at, including actually looking at national local herbs. So we are very happy. We can't wait to get their results in terms of their research. But coming back to what you said, are we still contact tracing? Absolutely. That is like the meat, the core of our intensified surveillance. You want to make sure that you are able to detect early, you are able to test, you are able to find those positive by PCR confirmation, you are able to isolate, you are able to manage. So there's no way in our surveillance we can drop following up contacts. No way at all. Every single positive case, we have to make sure that the contacts there are traced and they are tested, and we're able to then continue. If one of those contacts is positive, we go on to their contacts and so on. That is like the core of our response, basically, as it follows the testing.
All right, and then still on the figures, we still have 5 recoveries. Why is that we're not recording any more recoveries after this 5?
We do, but we also want to make sure that when you are said to be positive, we don't let you out in the society so quickly. There's no urgency. we have got to be satisfied that you're now negative. And for us to do that, you first of all then have to have a PCR test, negative, and then we have to repeat. So it's not just one PCR that you have. And for us, there is really no urgency in letting someone out there when we're not quite clear that they have had their 2 additional PCRs to confirm that they are truly clean and they're not going to continue passing on the infection to the public out there. So yes, we are continuing with our surveillance. Specifically, we are definitely not dropping the ball in terms of contact tracing. We're making sure that those that are positive, before we just let them go, they are retested and we're clear that they are safe to go out in the public.
All right, so now we've got 24 active cases. Are there any improvements?
As we're speaking, they're all mild, moderate. In other words, people who suddenly got tested and they're positive, they're not ill, they're not in ICU, in high dependency unit or anything like that. They're isolating at home. That's a good sign. That is actually a good sign that they are doing well. They're doing very well. Recently, I saw ZTV actually went and interviewed 2 of those that actually recovered. So it's a very strong message that we want to bring out to the public, that while we're doing everything we can together to make sure that we are prepared, you're doing all the hand washing, the covering your mouth, and so on and so on, let's also remember that it's only a very small percentage that if they do turn out positive, they go on to be critically ill and need to be admitted into intensive care or high dependence unit. The majority, over 80%, remain mild as the ones that you're seeing now. But most importantly, the messages that they must have, that the public must have, just because you're not very ill does not mean you're safe. If you're positive, you must continue isolating at home. You really must. You must continue wearing your mask so that you don't spread it. You must continue also washing your hands with soap and water, because you can also spread it. While you are not near me, I touch it here and I'm infected. You come along, you think I'm gone, you then get it. So the message is loud and clear: prevention, prevention, prevention. If you have it, prevent it. If you don't have it, prevent it. That is loud and clear to us.
So of the 24 cases right now, there's no one who is hospitalized as we speak right now?
As we speak now, we did have 1 or 2 that we actually hospitalized purely because when our rapid response teams went to their homes, they quite clearly realized, whoa, they cannot isolate at home, because the condition is that maybe they're a little bit crowded. So it's those kind of cases that we also say, rapid teams, when you go out there, once someone is positive, they go and assess the home, they see, whoa, they can't live here. Then we admit for isolation in hospital for that reason. Once again, we are very clear that our focus is to really prevent, to make sure that we are detecting, early detection of suspected cases, isolating those who are positive, ensuring that we are then managing appropriately. As I have said, if you assess the home, it's not quite the right conditions, that particular case must be admitted to prevent them from passing it on to others.
Coming to you, Dr. Mahachi, going forward, what do you think ought to be done to maintain the numbers or even flatten the country?
Thank you for that question. One of the critical, just to reiterate, one of the critical issues is we need to look at testing, isolating, and making sure the positives that are identified, we trace their contacts. That is the primary message. Expanding our testing and PCR-based testing, which is what WHO and other, FDA and so forth are recommending. So that's point number 1. Then point number 2, looking at, as Dr. MAHOMVA has described, a set of public health interventions that are really critical. So we are looking at, the use of face masks in public, which is a very important measure, making sure this is adhered. And people also understand, it's not just, you can't wear this mask every day. For the public, we are recommending use of, washable face masks like the one I'm wearing. After today, it must be washed, and then I wear it again tomorrow, making sure when you have the mask, you're not touching it. And then, I have glasses, and the temptation to touch the face is very, so making sure the correct messaging is put out there. So this is the responsibility of the risk communication pillar in the response plan, and I think a lot of work is going around that. Recently I saw in the social media, somebody checking the different face masks. So you can see there are still a lot of myths that need to be addressed to make sure that the message is there. So aggressively communicating, and I think that's happening, and we need to step up that. Then we are also looking at the issue of social distancing. Now that His Excellency has given the directive that companies and industries must reopen, how do we really make sure that we are not going to have those that are symptomatic or those that have been confirmed, going out there and infecting others, right? So practicing social distancing, hand hygiene, all of these critical measures. And in the workplace, it's really important for the employers to, it takes me back to the days of, early days of HIV when we had HIV workplace policies. So urgently putting in place risk mitigation measures at workplaces and businesses, right? So to ensure that we are really quickly identifying potential or suspected cases, making sure they have PCR-based testing in collaboration with the ministry, rapid response teams, their contacts are traced. This is the only way we can actually ensure that we eventually bend the curve. So these are the critical levers that we need to look at. And then also, there are issues to do with ramping up our response at lower levels, at district level across the country, so that whenever there is a case, the district teams, rapid response teams are ready to identify that case, test, isolate and manage accordingly, trace the contacts. So that whole cascade right up to the district and village level. At village level, we have the village health workers and a variety of community health workers. They are sensitized and making sure they are also delivering messages about enhanced hygiene. We manage issues of gatherings, funerals. So there is a whole range of public health interventions that we have to put in place to make sure we manage COVID-19.
Back to the issue of physical and social distancing, we've noticed like yesterday we were out, the youth team was out, and they noticed like there were some areas where people were not even respecting social distancing. We're looking at places like bus terminals, we're looking at people, there's a place there at Ivans where people actually go to buy chicken feed and stuff. There was a lot of stampede and all that. How can government maybe ensure that people really adhere to the social distancing regulations, because they're being violated?
Yeah, it's so this is a very important question. We are moving into this disease is new, and we are moving from our regular social interactions into a new normal, as many people have called it. And it takes time for habits to change, but unfortunately we don't have the time. So what is critical is the government to make use of its different arms in a respectful manner, to make sure that we enforce social distancing, whether it's in the queue in the supermarket, whether it's at Ivans as you are referring, whether it's at the bank. Really making sure we're working with employers, the responsible sector leads to implement these measures effectively. Treatment of cases is more costly than us actually preventing the cases from going up. It's more cost effective. So it's really important for us to put in place these measures and make sure, whether we're working with City Health, for example, they have their own enforcement system, whether we're working with the police, in a very respectful way, making sure that they are supporting the different sectors. Which brings me to the issue of, as we move towards the reopening industry, it is really important to make sure that all of the different sectors, have clear plans that are rapidly implemented. Unlike, other plans, maybe we have months and years to implement. This has to be quick, How are we going to to mitigate risk within the agricultural sector? We know it's tobacco marketing season for now. Perhaps it's decentralization of the markets for tobacco. So quickly implementing those measures that facilitate prevention of transmission of COVID-19.